So our newest technology that we're employing at RefinedMD is a device called Emface. And Emface causes a little bit of tightening and lifting of the face. And this modality works by delivering two different energy sources. Radiofrequency, which produces heat in the mid-dermis area, as well as an energy source called HIFEM energy, which is muscle contraction energy that tones and lifts the mid-cheek as well as the frontalis muscle on the forehead. So at RefinedMD, we are really proud to be able to claim we were the first to receive and be offering Emface treatments in the South Bay area. This is a good time to come in and kind of get a jump on the gun as far as building collagen and elastin in your face. You know, we get questions a lot about like, what is Emface? Where did this technology come from? How come I haven't experienced it before? And Emface is the product of a company known as BTL, which is from Eastern Europe. Their roots are in rehabilitative medicine, and now more and more they're pushing into the arena of aesthetics. So they brought us this wonderful new technology for tightening and toning the muscles in the face, which ultimately leads to fewer wrinkles and a more lifting effect. Some people, or actually the studies have shown that 3 months after a series of 4 treatments, most patients experience greater volume in their mid-cheek and less volume in their lower face or their jowl area. So it's kind of as if the toning that occurs during a treatment tightens the smaz, the lower layers of the face, and moves volume from down here to up to here, which leads to a more youthful appearance. Emface clinical studies have documented a 37% reduction in wrinkles, a 23% lifting effect, and a 20% increase in collagen in the facial tissues. We have many patients that ask us what an Emface treatment consists of, and this is a sequential treatment. We treat patients once a week for 4 weeks in a row. You can expect to have a 5th appointment with us as well, about 2 to 3 months following your last treatment, so that we can see in the photography that we take before and after what level of improvement we've achieved. So what we're really looking for are changes that may occur around the mouth, in the lower face, typically perhaps in the jowls and in the upper neck, as well as a reduction in wrinkles on the forehead. What does an Emface treatment feel like? An Emface treatment is a little bit of electrical stimulation, so it feels a little twitchy, I would say sparkly, if you will, in the skin, as well as the gentle heating that you feel just beneath the 3 applicators themselves. So it's not an uncomfortable treatment. Some patients do experience a little difficulty speaking or enunciating because the muscle contractions are so strong. So it's a treatment though that you can just lie there and experience it. It takes 20 minutes, and at the end of the 20 minutes, your skin is kind of back to normal and there's no noticeable downtime or side effects. Who is a good candidate for Emface? Someone who's concerned about support in their skin, elasticity, a little volume loss in the mid-cheek area. These are all good candidates for an Emface treatment. I think no one is necessarily ruled out because of their age for an Emface treatment, but I think some of the prime candidates are perhaps between 30 years old and 55 or 60 years old. So the question does come up, and we can go over this more thoroughly in consultation with you when we talk to you about your series of Emface treatments. But does Emface play well with toxins, Botox, Dysport, Xeomin, as well as can I use Emface over various hyaluronic acid fillers or other fillers in the face? The answer to both those questions is yes, Emface is compatible with those. Sometimes timing becomes an issue, and we can discuss that at the time of your consultation, whether the Botox should be first or days after an Emface treatment, etc. But you can discuss that in consultation with your provider here at RefinedMD. So what's the difference between an Emface treatment and a surgical facelift? Perhaps the most obvious and the most sought after difference between these two treatments is the fact that an Emface treatment is pain-free and needle-free, and also minimal recovery time. In general, this treatment causes some thickening of the muscles in the facial structure, which provides a lifting effect as well as of a supporting effect to tissues in the lower face and in the submentum area. So Emface can also safely be used if a patient has either already had a facelift, and in that case we're using Emface kind of more in maintenance mode to maintain the results, perhaps on an annual basis, that they surgically achieved at the facelift. Emface can also be used for pre-surgical patients. It has been shown to thicken and tone some of the deeper layers in the face that surgeons may be accessing to do a facelift, and will allow the surgeon to provide more support when they actually do the surgical lift. So we can both prepare for surgery using Emface as well as maintain results with Emface at post-surgery. So in summary, Emface is a lower cost alternative to a facelift, which has longer recovery time and usually a much higher expense than a series of Emface treatments. Let's cut and take a look and see how Dr. Roy is doing in the treatment room. He's experiencing his first Emface treatment today.
Hi guys, this is Dr. Roy, board certified facial plastic surgeon here at Refine MD. Got down a little bit early in the surgical center today, so I figured I'd have a good opportunity to be the second male patient that we do the Emface treatment for.
Hi everyone, my name is Elise, the body treatment specialist here at Refined MD, and we're ready to treat Dr. Roy with some Emface. I have all my materials ready. We got his hydration levels, got some before pictures, so let's get started. First, start by turning up that heat.
Okay.
All the way, 100%. Wait just a few seconds, and then we're going to start with those muscles.
Okay, the treatment just ended, so we're going to go ahead and detach Dr. Roy's applicators here. Got all three of them loosened, and we'll gently remove them from his forehead. Yep. Smile at the camera and get down the roll out.
Hey.
So for any of you watching this video and kind of looking forward to learning more about Emsculpt, we do have an event in our office next week on November 10th from 5 to 7 p.m. We will be showcasing Emface treatments and answering your questions there, as well as demonstrating some other technologies by the same manufacturer of Emface, so that you can see kind of how complete the whole family of devices is, and all the issues that we can address using BTL technology.